Good morning, everybody. Thank you, Ivo. And as many of you know, I co-chair this initiative, the Global Food Security Project, with my colleague, former congressman. We served together in the House, Doug Bereuter from Nebraska. It's Nebraska and Kansas, so we run the show today, you know. And I also want to recognize Catherine Bertini, who was our partner in this effort and got it off the ground to begin with. So, and I know she's going to be talking a little later. The Chicago Council has done numerous in-depth studies on a variety of issues affecting our food system. Last year, we looked at how climate change puts food security at risk. Previous reports have talked about innovation, partnerships with the business sector, and reformed trade and regulatory policies to meet future food needs. For our annual report this year, as you can see from the booklet, all of us at the Chicago Council agreed there were few issues more pressing than nutrition and malnutrition. Malnutrition in all of its forms, either too little food or too much food or the wrong type of food, is affecting every country in the world, including the United States and other developed countries. It claims the lives of 3.1 million children under 5 each year. It puts 1.9 billion people at risk for chronic disease, and it is a problem that is nearly entirely preventable. And while the report and the discussion today will focus primarily on global food security issues, we do not want to isolate the United States and other developing countries from both being part of the problem and being part of the solution to these issues. Scientists have studied how people's diets change depending on where they live and their income. So given demographic trends, we know that if we continue on this path of business as usual, we are going to be facing a major healthcare crisis. In fact, the fastest growing part of the U.S. budget and the major contributor over the next several years to the budget deficit are healthcare costs in the Medicare and other healthcare systems associated with chronic disease. This is a giant fiscal problem as well. Population is expanding and more people are moving into the middle class. These growing incomes combined with the urbanization happening everywhere means that people's diets have to change. We have an opportunity now to prevent this crisis and improve the health of billions around the world. The agriculture and food sectors are driving forces in overcoming malnutrition. Those working in the global food supply chain can provide diverse and nutritious diets at an affordable price. The global food system can make food safer and reduce its waste. Agriculture and food also employs billions of people around the world and provide those people incomes to purchase nutritious food. Yet too often the agendas of the food sector, the agriculture sector, the nutrition sector, and the health sector are often not linked up. They're often stovepiped, and people are not really talking to each other. In fact, the health sector rarely considers food as a preventative tool for chronic disease. This must change for us to improve people's health. So this year, the Chicago Council looked specifically at how the global food system could make life-saving progress in overcoming malnutrition. This new report makes the case for why the U.S. government should provide leadership on these issues, and the case for why farmers and agribusinesses and others involved in the food industry should champion the cause of nutrition. It was developed by a task force made up of agriculture, food, health, nutrition, and development experts led by our colleague, Catherine Bertini. And I'm grateful to my co-chair, Doug Bereuter, Catherine, and all of those who worked to develop this report for their tireless efforts. Now let me touch on the main points of the report, and then I'm going to call on Doug, who will talk about some of the strategies and interventions to deal with the issue. Malnutrition is assaulting our health and our economies. Right now, as many as 2 billion people suffer from micronutrient deficiencies. And again, that's worldwide, largely in the developing world, but also in the developed world. At the same time, 1.9 billion people are overweight, including 600 million people who are obese and headed down a dangerous path towards greater risk for chronic disease. A recent International Food Policy Research Institute report estimated that 1 in 2 people in the world are in some way malnourished. That malnourished comes with a giant price tag. Regarding our health, half of our children's deaths under 5 are attributed to malnutrition. Chronic disease, many of them diet-related, Diseases like diabetes, many forms of cancer, many forms of heart disease related problems are now the leading cause of death worldwide. Many people are dying from diet-related diseases like heart disease, type 2 diabetes, and some forms of cancer are passing away in the prime of their lives when they are the breadwinners of their families, and even coping with communicable diseases like Ebola, tuberculosis, malaria. What people do in terms of consuming food has a lot to do with their ability to resist those diseases as well. The costs of malnutrition aren't just social, they are financial. Treating malnutrition costs most countries on the average of 4 to 9% of their annual GDPs. Malnourished workers are also less productive workers. The lost productivity globally from diet-related chronic disease could reach $35 trillion by the year 2035. Adults that were malnourished as children earn on average 20% less than those who are not malnourished. Our governments, including the United States, cannot afford this health care burden. Our businesses cannot grow when productivity is hampered, and our consciences should not permit us to live with these social costs. The good news is that our food system can be a key partner in alleviating malnutrition. Modern food systems have successfully produced vast quantities of food, fiber, and feed, averting food shortages and spurring economic growth. Yet these advances have not all reached the world's farmers and haven't always been environmentally sustainable. In low-income countries in Africa and South Asia, some of the poorest and most malnourished people are farmers. Their yields are less than half of those in the United States. We need a food system that focuses on the quality of the food produced and takes nutrients and dietary diversity into account. The food and agriculture sectors have unique potential to address many of the underlying causes of malnutrition. They can increase productivity and crop diversity on small-scale farms. They can improve the lives of farmers and workers, especially women, who are change agents in overcoming malnutrition. And we will hear stories about that today. The food system can increase post-harvest processing and reduce food waste to make nutritious foods available to more people. The food system can help people make healthier and better choices through retailing and marketing schemes. And it can also make sure that food is safe to eat. The time to tackle these challenges is now. There are growing constraints on water and land resources, which is making it harder and harder to increase food production the way we've done it in the past. Adding 2 billion people to this planet by the year 2050, including those with much higher incomes, will increase food demand by 60% if we don't reduce food waste or change the way that food is produced. Climate change is reducing production, increasing price volatility, and negatively affecting the nutrient content of our food. And without new strategies to make sure food production can meet demand, we will face food shortages and higher food prices and extremely volatile food production. The number of those who can't afford healthy food will climb. So the time is now to make the agriculture and food sectors partners in tackling malnutrition. The people working in the agriculture and food sectors should be at the table, working alongside healthcare professionals, businesses, development practitioners, and educators to move the needle on nutrition. Investing in health is not simply a humanitarian matter. It is squarely in the interests of the United States. Businesses stand to gain from the growing consumer demand for produce and nutritious foods. The global fruit and vegetable market is projected to be valued at $2.3 trillion by the year 2017, an increase of over 50% from 2012. While undernutrition is not a conspicuous problem here in the U.S., more than 1 in 10 families in the U.S. do suffer from food insecurity. More than 2/3 of Americans are overweight or obese today. Addressing malnutrition, especially diet-related chronic diseases, is critical to the health and economic development of the United States. Over the last few years, we have had the largest number of people in America recipients of the SNAP program. In the past decade, the U.S. has made extraordinary investments in health and agriculture globally, including committing $40 billion in PEPFAR, malaria, and tuberculosis initiatives over the past 4 years, along with $1 billion annually to the Feed the Future initiative. These investments are for naught if people are malnourished. Those who are sick with HIV, AIDS, or malaria cannot recover and stay healthy if they're malnourished. Small-scale farmers aren't as productive when they are malnourished. Investments in nutrition can yield larger returns for health and agriculture program. In closing, the agriculture and food sectors can increase the quality of our food and give billions more people access to the nutrients they need to thrive both here and abroad. With its world-renowned agri-food businesses and universities and the power of its assistance and example and the leadership of NGOs and the foundation world, the U.S. should lead the way. The Chicago Council report puts forward a number of specific recommendations on how to do this, and to present those, I am pleased to give the floor to my fellow co-chair, Doug Bereuter. Thank you all very much.
Good morning to all of you. Thank you, Dan, for detailing the landscape in which this report was developed. As Dan mentioned, this strategy proposed in this report clearly benefits the United States as well as others around the world. However, some of the most important beneficiaries are small-scale farmers in sub-Saharan Africa and South Asia, who make up over half of the world's chronically hungry and malnourished. The United States has tremendous opportunities to offer leadership in building global food systems that can really propose and improve nutrition practices. The Healthy Food for a Healthy World report argues that the U.S. can best contribute to our areas in 4 key areas. They are science, education, business, and public policy. An essential component of all of these recommendations is partnerships. Partnerships between the U.S. government, universities, businesses, and civil society, international organizations, and research institutes. But most importantly, partnerships with other countries. And implementing these recommendations will help build a sustainable food system that promotes health and nutrition here in the United States as well as abroad. First, we recommend that the U.S. make global food security a long-term foreign policy priority. Commendably, both the administration and the Congress have taken great strides lately in that respect. However, our American government needs to commit to a strategy that lasts beyond one presidential administration. For this to happen, Congress needs to make food security an enduring foreign policy priority. The challenges of feeding the world and dealing with malnutrition are not going away. We need authorizing legislation to put on a solid basis a long-term approach. And we need to sustain the funding for agricultural development at a level of at least $1 billion per year. Congress can and should create a commission with the responsibilities to continually push for a coordinated approach to global nutrition. Such a commission, their membership should include congressional administration, business, and civil society leaders. Second, the report recommends that we prepare the next generation of leaders in food and nutrition security. In the 1960s and the 1970s, U.S. universities partnered with institutions in low-income countries to train thousands of foreign students in agriculture. These students are today's leaders in those countries. Unfortunately, the U.S. has moved substantially away from investing in research institutions and universities abroad. It has significantly moved away from educating foreign students in agriculture and food sciences. This should be changed. The U.S. should leverage its world-renowned university system to help transform and help universities in developing countries. It should also educate more students entering the agricultural, food, and nutrition fields. We have a history to demonstrate that we know how to do this well. We need to begin once again and revitalize it. Although investment in basic science is important in developing agricultural sciences, we need to have today a collaborative mix of disciplines and variety of skills. To address the problems facing food systems today, we need leaders coming from the fields of engineering, business, finance, and law as well. And of course, for a sustainable, nutritious food system, we need dietitians, public health professionals, women's health advocates, and journalists, and all of them working together. Third, we recommend that research on nutrition and agriculture be significantly expanded. We know that science has the ability to meet and triumph over food crises. Today, we need agricultural science since we have to deliver innovations to feed the world's people more nutritiously. Investments in agricultural research have traditionally prioritized a limited number of crops. We need to expand beyond rice and wheat and corn to also invest in research for legumes, fruits, vegetables, and orphan crops. Fourth, the report highlights specific priorities of research, which you can see here up on the screen. I want to elaborate on 4 of them. Improving access to healthy diets is critical. The current fruit and vegetable supply is far from sufficient for everyone to meet the recommended nutrition intakes, especially in low-income countries. Indeed, we need research across the entire food value chain to increase production, reduce costs, and improve the storage, processing, and transport of horticultural crops. And of course, food safety is an essential component of nutrition. Even if food is healthy, it can do more harm than good if it's contaminated or causes disease. Aflatoxin contamination, for example, is one of the most pressing food safety challenges in developing countries today. It affects 1/4 of harvest across the world in marketplaces. Next, we need to figure out how to get people to actually eat healthy food. No easy task. Even if people can afford a diverse diet, it makes no difference unless they actually eat healthy food. So changing behaviors has to be a focus. For example, projects on producing sufficient nutritious, rich foods should also incentivize farmers to actually consume them. A final area where we desperately need innovations is to reduce food waste. Inadequate post-harvest storage, poor cold chain development, and underdeveloped transportation networks make it hard to get perishable crops to the markets. We need better storage facilities, processing capabilities, and transportation networks to extend the availability of fruits and vegetables. Fifth, we need to increase the transfer of proven approaches and innovations to farmers everywhere, but especially to women and underproducing farmers in the developing world. It is crystal clear that women's empowerment is critical for improving nutrition. When women have more control over the resources allocation in their own households, the nutrition status of the children and their education and the entire life of the family is improved. Finally, the report addresses how the government can better partner with the private sector to support food systems which emphasize nutritious outcomes. Processing more food can be a game changer for nutrition. Right now, 40 to 50% of all fruits and vegetables, that's right, 40 to 50%, and 30 to 40% of grains spoil after harvest because of lack of storage and preservation facilities. While we need to move away from what might be termed ultra-processed food in our diets, there is still a serious need to expand primary processing in developing countries so healthy food can be preserved long enough to be eaten. In conclusion, ladies and gentlemen, we can't ignore the growing double burden of undernutrition and obesity that is costing lives and trillions of dollars in health care and lost productivity. With strong leadership, we can not only increase access to healthy food, but also create a global food system that delivers quality nutrients and dietary diversity. With unparalleled expertise, historical experience, and leadership potential at its disposal, the United States should tackle this opportunity head-on for humanitarian reasons and also because it's in our national interest to do so. So between Dan and myself, you have had a short summary of the report. I urge you to digest it, to look at it. I think some of the examples in the boxes are particularly interesting, graphic and very helpful in illustrating what can be done with innovation and hard work. Thank you very much for your attention. Ladies and gentlemen, I urge you to look at this report and help us implement it. Thank you.